YouTube channel, and in succession to the previous video where I have discussed important one-liners MCQs from pathology, general pathology. So in succession to that video, first part of the video I've already discussed, that is the first 50 MCQs. The next 50 MCQs I'm going to discuss. I'm starting this the second part of this video. So beginning with, so in this video this video will be mainly focusing on, not by giving options straight away, we'll learn the answers out of the 4 options, what would be the correct answer, and from just by remembering these one liners MCQs, you can straight away choose a correct answer in the multiple choice questions. So these are actually the one liners. You just need to memorize them, and when it comes in the form of multiple choice questions, you need to straight away put the correct, tick mark the correct answer and fetch your marks. So beginning with, so the next 50 MCQs I'll be discussing in this video, and beginning with now. Already up till the first 50 MCQs I have discussed, that is the highest concentration of hydroxyproline is seen in. So the hydroxyproline, it's a very important chemical which is found in collagen. So the highest concentration of hydroxyproline is seen in collagen. So up till this MCQ we have already discussed in the previous video. Moving on, the next important MCQ, what they can ask you in the form of multiple choice, that wound contraction is mediated by. So actually, what are the cells which are responsible for the contraction of a wound? It is the myofibroblast. So it is the fibroblast which is having the skeletal, the muscular component, and it is the wound contraction is mediated by, out of the 4 options, you are going to select one. That is, the wound contraction is mediated by the myofibroblast. Moving on to the next important MCQ, that is the complete restoration of tensile strength of the wound comparable to normal tissues takes so as long as 6 months. So in the multiple choice questions, they also ask you about the duration, that what is the time duration, what is required for the complete restoration of a tensile strength of the wound comparable to normal tissue. So once the process of wound healing sets in, so this wound healing process, what time will it take for to give the similar resemblance to the normal tissue? It is as long as the period of 6 months. So do remember, students, for 6 months this will take. Now the next important MCQ is, in wound injury, what is the sequence of appearance of cells? So out of 4 options they'll be giving you, and you just need to memorize the sequence, that in wound injury, the sequence of appearance of cell is starting with platelets. Next comes the important cell, that is the neutrophils will come during any kind of a wound when it is happening. So first line of defense of cells, then neutrophils will come into play. Later on, there comes the macrophages, and last it comes the fibroblast. So this is the sequence of cells what comes in wound injury. Now the next important MCQ is, maximum collagen is in wound healing is seen at the end of 2nd week. So do remember, students, that maximum collagen, at what stage of wound healing the maximum amount of collagen is going to be found? It is at the 2nd week. The maximum collagen in wound healing is seen at the end of 2nd week. Now the next important MCQ is that acid phosphatase is specific to. So do remember, acid phosphatase is specific to what cells? So it is specific for the monocyte cells. Now the next important MCQ, what is very frequently asked is, during the basement membrane degeneration is mediated by which enzymes? So do remember, out of the 4 options, they'll be giving you so many options, and you need to just choose this metalloproteinases. So the basement membrane degradation is mediated by the metalloproteinases. The next important MCQ, what can be framed is, the articular cartilage is made up of what type of collagen? So in the temporomandibular joint, you must be remembering that in the TMJ, you must have heard of the articular cartilage, and there is an articular disc as well. So the articular cartilage is made up of what type of collagen? It is collagen type 2. The collagen most abundant in hyaline cartilage. So do remember, the most abundant collagen in hyaline cartilage is the type 2 collagen. The most abundant glycoprotein present in basement membrane is, so they'll be giving you out of so many options, the option what you need to take is the most abundant glycoprotein present in basement membrane is laminin. Now, sickle cell anemia. So they can ask you in multiple choice question, what kind of a mutation is found in sickle cell anemia? So sickle cell anemia is due to point mutation. The next important MCQ what they can ask is that single gene disorder which does not follow the Mendelian inheritance is the fragile X chromosome. So do remember, students and viewers, the single gene disorder which does not follow the Mendelian inheritance is the fragile X syndrome. So the next important MCQ is the approximate number of genes contained in a human genome is 30,000. So students, do remember, you must be very well aware that the human genome contains of an haploid set of chromosome. So the human genome contained in the approximate number of genes what are contained in the human genome, that is the haploid set of chromosomes in human beings, it is 30,000. The next important MCQ what they can ask is that Y chromosome is having what shape? So do remember, the Y chromosome is having an orientation what is called as the acrocentric. The next important MCQ is the NK cell, that is the natural killer cell. It is a large granular lymphocyte. What kind of a cell it is? It is a natural killer cell. It is a type of a lymphocyte and which is having large granules in it. So natural killer cells, they are a type of lymphocytes. Now CD8. So CD8 is a marker of cytotoxic. CD8 is a CD marker of cytotoxic cells. So this is the next important MCQ. Okay. Now moving on to the next important MCQs, we'll be moving on. So starting with the first very important MCQ, what they can frame is that is the cell involved in humoral immunity. So do remember the cells what are involved in humoral immunity, it is the B cells. So cells involved in humoral immunity, it is the B cells what are involved, as well as the cell mediated immunity is mediated by the T cells. So cells involved in humoral immunity or the immunity which is conferred by the antibodies. So this is mediated by the B cells, whereas the cell mediated immunity is conferred by the T cells. Now, the next important MCQ what they can discuss is phagocytosis is a function of. So what kind of cells are responsible for phagocytosis? They functioning, the microglia cells, they perform the function of phagocytosis. Now, the primary location of toll-like receptors. So do remember these toll-like receptors, they can come as an MCQ. The primary location of toll-like receptors is they are found in the plasma membrane. Now, the next important MCQ is natural killer cells attack cells which are not able to express. So natural killer cells are going to attack what kind of cells? So they are able to attack cells which are not able to express, that is the membrane histocompatibility MHC1. So MHC1, it is the natural killer cells, they attack cells which are not able to express this membrane histocompatibility MHC1 gene. So the next important is Gaucher's disease. Again, another very important MCQ. Gaucher's disease is due to accumulation of which of the following glucose substance? So the Gaucher's disease is due to the accumulation of glucocerebroside. So do remember, Gaucher's disease is due to accumulation of glucocerebroside, a defect in the enzyme adenosine deaminase. So a defect in the enzyme adenosine deaminase shows what kind of what kind of a trait it is. It is an autosomal recessive trait. Now the next important MCQ is inheritance of X-linked recessive trait is that. So whenever an X-linked recessive trait is being inherited, so what it is going to manifest in the form of, so inheritance of X-linked recessive trait is that 50% of the boys of the carrier mother are affected. Now, moving on to the next important MCQ, that males are more commonly affected than females in what kind of a uh, transmission. That is, it is in X-linked recessive type trait, males are more commonly affected than female. Now, the next important MCQ is that reverse cholesterol transport is mediated by HDL. So another very, very important MCQ what they can ask is, that is, the reverse cholesterol transport is mediated by which of the following: LDL, HDL, VLDL. So reverse cholesterol transport is mediated by the high density lipoproteins, that is the HDL. Now the last MCQ for this session, it is the in Marfan syndrome. Now in Marfan syndrome, aortic aneurysm. So aneurysms is certain kind of a this if it is found in Marfan syndrome, so aortic aneurysms, which is the abnormal dilatations of the aorta, occurs in what aorta? It occurs in ascending aorta. And the last MCQ for today, that is 25th MCQ in this video I'll be discussing. So the last MCQ what is there, the chances of having an unaffected baby when both the parents have achondroplasia, it is 25%. So students, this was a very important discussion. And next important MCQ is that the maternal disomy of chromosome 15 is seen in what chromosome? So actually do remember, xeroderma pigmentosum uh, defect is what is the defect is in the nucleotide excision repair. And the next important MCQ, that is the maternal disomy of chromosome 15 is seen in which of the following syndromes? So it is the Prader-Willi syndrome. So maternal disomy of chromosome 15. So students do remember, the maternal disomy of chromosome 15 is seen in Prader-Willi syndrome. So do remember students, maternal disomy is associated with chromosome 15, which is seen in Prader-Willi syndrome. And the next important MCQ is, that is the glucose 6-phosphate deficiency. It is what kind of a trait? So it is an X-linked recessive condition. Glucose 6-phosphate deficiency is an X-linked recessive condition. The last MCQ for today, it is the Marfan syndrome has an autosomal inheritance. So students and viewers, this was the next 25 30 MCQs in this session I have discussed. The remaining MCQs in the form of 25 or 30 in one group, I'll be uploading in the upcoming pathology lectures. So viewers, so this was the next 30 MCQs what I have discussed. In the upcoming videos, I'll be discussing about the next 50-30 MCQs. So stay connected. If you like this video, give this video a thumbs up. And students and viewers who are new to my channel, for more, because since NEET PG entrance exams for medical as well as the dental, for MBBS students as well as the BDS students, the NEET PG entrance exams is approaching. So this sessions nowadays I'll be mainly focusing upon, I'll be trying to mug up and summarize all the multiple choice questions what are related to pathology, pharmacology, physiology, anatomy, biochemistry. So I'll be discussing the one-liners MCQs what can be frequently asked in the NEET PG entrance exams. So if you like this video, give this video a thumbs up and do share it amongst your friends. If you haven't subscribed the channel, subscribe my channel and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.